Now, World Kidney Day is a day set aside to raise awareness of the importance of kidneys to humans' beings' overall health. It's also a day to talk about how to reduce the frequency and impact of kidney disease and its associated health problems worldwide. Medical journals report that an estimated 80% of kidney diseases occur in low or middle-income countries, with chronic kidney diseases remaining a worldwide health crisis. Joining me on the news to discuss this is a consultant nephrologist at the Federal Medical Center of Nigeria and National Secretary at the Nigerian Association of Nephrology, Dr. Lekan Ojo. Good evening and thanks for joining us on NC Continental Prime, Dr. Ojo. Good evening, Dr. Ojo. Thanks for joining us.
Thank you very much. Good evening, viewers at home.
Now, Dr. Ojo, let's start by talking by taking a look at the theme of this year's observance: kidney health for all. How does this theme resonate with us?
Thank you very much for that question. Yes, we are talking about kidney disease for all, and with a specific focus on bridging the knowledge gap to better kidney care. And for us in this part of the globe, it is important to know that we have an increasing burden of chronic kidney diseases, and it is not uncommon that when you switch on your television, you will see that a lot of requests is being made now for individuals to be supported for kidney care, and it's becoming so common. And one of the things that has been noted world over is the fact that if we are able to detect the causes of kidney disease early, we might be able to mitigate the effect, because the cost of kidney care for an individual might be able to take care of over 100 or 200 individuals. So we chose the theme that we want to bridge the knowledge gap. And to bridge this knowledge gap, we want to approach it at the community level, at the health worker level, and then public health advocacy. And so we decided to go to town to increase the awareness of the populace on the rising incidence of kidney disease and what we need to do to prevent, because really prevention is better than and cheaper than the attempt to cure it. Thank you very much.
Now, reports in some medical journals on the cases of kidney disease can be quite alarming. How is Africa doing on the log of kidney-related diseases?
Sorry, I can't get that question.
I said reports in some medical journals about kidney diseases is quite alarming. How is Africa doing on the log of kidney-related diseases? How prevalent are kidney-related diseases on the continent?
Kidney-related diseases is very prevalent, and even in the Caucasian population, let's look at America, for instance. The burden in African Americans is higher than what we have in the white population. And there was a systematic review of all the publications between 2000 and 2016 on kidney diseases. And the prevalence in Africa was put at about 15.8, compared to the general prevalence in America, which was put at 13.1. And even in in Africa itself, the average prevalence in North Africa is about 6.1, in West Africa, 19.8, in Middle Africa, 16.0, in East Africa, 14.4, and in South Africa, 10.4%. So the average burden of kidney disease in Africa is actually bigger than the rest of the world. And if you go to America, where we have some heterogeneity, it is heavier, worse, with a poor prognosis amongst the African Americans than the whites. And if we look at it very critically, we know that the initial problem that we had in Africa was more of communicable diseases.
Hello, Dr. Ojo, are you there?
Lifestyle. Okay. Then we have the non-communicable diseases coming on. And of recent, emphasis is now shifting even to the gene. So there is what we call the ApoL1 gene.
Hello, Dr. Ojo. Yes. We seem to be having some technical issues with you. Okay. So I'll let you land, Dr. Ojo.
Okay. So I said the burden in Africa is worse than what we have in the rest of the world.
Okay.
And that in America. Okay.
Now, we've heard reports linking the increased use of unregulated herbal concoctions in Africa to kidney diseases. Is this correct? And is there any link at all? Is it a contributory factor to kidney diseases?
Yes, it is. Now, the predominant causes of kidney disease in Africa are hypertension, chronic glomerulonephritis, diabetes mellitus. Now, unregulated drugs, especially the non-steroidal anti-inflammatory drugs, the drugs that we use for pain and all the others, have a significant contribution. And that also, of course, herbal medications too. We talk of toxic, herbal nephropathy. So all of these contribute to kidney diseases.
Now, what can be done?
Then, of course, when we're talking...
What can be done to reduce the burden of kidney diseases in Africa?
Yes, to reduce the burden of kidney diseases, we have to tackle it at various levels, like we have done now, calling attention to the increased prevalence. Everybody needs to be aware. The commonest causes, like we said, hypertension, diabetes mellitus, HIV, chronic glomerulonephritis, sickle cell. Now, any individual, every person needs to know their state. You need to know your figures. Because, for instance, hypertension is said to be a silent killer. Many individuals are hypertensive without knowing. So know your blood pressure. If we are able to take care of hypertension, we might be able to prevent development of chronic kidney disease. Diabetes mellitus, well managed, we can delay the development or progression of chronic kidney disease, avoidance of or regulation of medication, because in Nigeria today, you can go to anywhere to get any medication. It is important. Then when people contract some conditions like HIV, if they are treated early, we might be able to prevent nephropathy. Then there are certain substances that are used, like this bleaching cream, like mercury, yes, in some. So all these things, if we are able to do without them, we might be able to reduce the effect of all this. And then if an individual suffers a condition in a family, because a lot of secrecy has been associated with us here. Even some parents, some children don't know the cause of demise of their parents or even siblings. We need to be more open about all these things. So we can, then we know that the child, the weight of a baby when he's born is also closely linked to developing chronic kidney disease in life. So if we're able to take care of pregnant mothers, we prevent low birth weight, we prevent complications during childbirth, we might be able to prevent it much later.
Thank you.
And then once,
Okay, I'll let you make your point, Dr. Ojo.
Then the government needs to also help, because if the cost of taking care of hypertension, for instance, is if the government is involved in it, then you are not charging exorbitantly on the cost of hypertensive drugs, diabetic drugs, and all this, then people can afford it. Because once you are able to take care of the causes of kidney disease, we might be able to either prevent or delay it altogether. Thank you.
Thank you very much, Dr. Lekan Ojo, for your contributions and insights on the subject. We do appreciate it.
Thank you very much.